Hello, I'm Jennifer Lewis at Wise Medicare, and today we're going to talk about your enrollment into Medicare Part B. As you know, your red, white, and blue card contains two levels of coverage. Part A represents hospitalization services. This typically comes at no cost to most individuals, mainly because you've worked 10 years over the course of your lifetime. Therefore, we will always encourage you to enroll in Part A at the time you become eligible, which is 3 months prior to your 65th birthday. Part B, on the other hand, covers medical expenses. For most individuals, you may already have medical coverage, and so we'll review the circumstances that are appropriate to defer enrollment into Part B. And it also carries a monthly premium, which I'm going to share with you in just a moment. If you're already drawing Social Security or you've been on Social Security disability for more than 24 months, know that you are going to be automatically enrolled into both of these programs. You should keep an eye out in the mail for your red, white, and blue card, at which time you'll be eligible for Medicare plans that are available in your area. As we discuss options to defer enrollment into Part B, it is important that you know that there is a late enrollment penalty if you do not enroll when you are eligible. So pay close attention, always ask questions, and reach out to your Wise Medicare team to make sure that you're on track to avoid this penalty. Your Medicare Part B premium is listed on the screen. A couple things I wanted to note. It is always based on your tax filing status and income levels from 2 years prior. This monthly premium is subject to change every year based on the government's review, so it can go up and it can also go down. So just keep an eye on that. At the time you enroll into Parts A and B, if you are already drawing Social Security, this premium will be deducted each month from your Social Security check. If you are not drawing Social Security, this will actually be billed to you on a quarterly basis. So your first bill will actually include 3 months premium. And that can be a little bit much for people to take. So if you're not happy with that, pay the first quarter and then sign up for Medicare's Easy Pay program. This allows that monthly premium to come automatically out of your checking account. That will continue until you enroll into Social Security, and then that premium will switch over to your Social Security check as we previously described. When enrolling into Part B, most instances you're going to want to. Specifically, if you're on an individual marketplace plan, you'll find that Medicare plans offer significant savings as well as enhanced benefits overall. If you are coming off of a group plan or you're planning to retire, this is an appropriate time to get Part B, as we're going to need to enroll you into Medicare plans to continue your coverage. If you are working and using your employer's insurance, if they have less than 20 employees total, they're considered small group coverage. Therefore, your Medicare coverage is going to serve as primary for all medical bills. Therefore, we're going to want to get you plugged into the appropriate Medicare plan to cover those expenses so that you're not left coming out of pocket unnecessarily. Lastly, many federal employee programs such as TRICARE for Life, GIHA, CHAMP VA are going to require you to enroll in Part B in order to continue those services for the next years. The instances where we're likely to defer Part B is if you are receiving group coverage through a large group employer. So that means 20 or more employees in the organization. And as long as your health coverage includes prescription drug coverage, you should be good to go. We will always look at that. But what I would always encourage you to do is to still compare your group plan to the Medicare options available. Oftentimes, you'll find that Medicare may serve to lower your premiums, your out-of-pocket expenses, deductibles, and overall benefits. So we'll be happy to review those options before you make the decision about your Part B to ensure that it is the right plan for your future. When you're ready to enroll in Medicare Part A and B, simply go to ssa.gov. You'll see Sign Up for Medicare. You're going to go ahead and click this and follow the prompts. If you're signing up for both A and B, you're going to select the first option. If you're coming back after a while just to sign up for Part B, select the second link. I will tell you that you will get to a point where it's going to ask you to create or log into your Social Security account. If at any time you run into problems in doing this, reach out to your team at Wise Medicare or contact your local Social Security office. They can help in assisting you in resetting your password or getting your questions answered directly. If you have any questions along the way, of course, our team at Wise Medicare is always here to assist you. You can reach us online at wisemedicare.com or visit one of our local offices at any time. Have a wonderful day.